Hi, Dr. Yass here. In this video, I want to talk about the diagnosis of SI joint dysfunction and how it happens to pertain to the last two people that I treated. One I treated by Zoom, the other I treated in person. Both had gluteal region pain. One had pain for the past 7 years. The other has had pain in that region for almost 20 years. Her own brother talks about the fact of how the pain has led to such anger and frustration that she's very tough to be around because she's constantly lashing out. And he even recognizes that she's lashing out because it's impossible for her to go almost 20 years in pain. And at this point, almost believe there may be no chance of ever ending that pain. So I want to talk about this diagnosis and why, in my mind, SI joint dysfunction should be perceived as a criminal diagnosis. And the reason I say criminal is because the diagnosis has no meaning. It doesn't really represent anything. And as a result, it doesn't direct any practitioner to a tissue to treat as the tissue in distress, eliciting the symptom, which would then allow the symptom to be ended. The diagnosis, SI joint dysfunction, think about the words sacroiliac joint dysfunction. It's not functioning properly. What does that mean in terms of a tissue? What's the tissue? The bone? The ligaments? The muscles that surround it? What are you supposed to be treating to resolve the distress of that tissue that's eliciting the symptom in this region? The diagnosis it's no different than the diagnosis whiplash that's given when someone has a car accident and they're having pain in the neck region. What tissue is in distress eliciting the symptoms? Whiplash does not identify a tissue. SI joint dysfunction does not identify a tissue. So you just go on and on and on, getting all these different types of treatments, and nothing works because nothing is purposeful. Nothing is directed towards a tissue that is creating the symptom in the region. So as far as I'm concerned, and I really strongly believe in this idea that there has to be some sort of responsibility for what's happening in the medical field when people are giving diagnoses that have no meaning and basically will never lead to a treatment that will end the pain, which is why the last two people I've treated who happen to have pain in the same area have had pain for 7 years and almost 20 years, respectively. This is criminal and it has to stop. Just so you could understand the idea of why the Yass method that looks to identify tissues and create an understanding of what tissues in distress so that that tissue can be addressed properly, ending the distress of the tissue, thereby ending its need to elicit this symptom of pain or other symptoms. If you look at the SI joint, sacroiliac joint, it's a joint like any other joint. What is the purpose of joints? It is to allow for range of motion to occur. Everyone has to see that is the basis of the joint. That's what joints do. So if we recognize that pain is an indication of a tissue in distress and you're trying to convince me that the pain is coming from the joint, then you've got to present to me that there's distress of the joint, thereby indicating that there's a loss of range of motion. The SI joint works in conjunction with the hip joint. And so when you do hip flexion and extension, the iliac portion of the joint moves forward and back. On the sacral portion, when you're doing abduction, adduction, they open and close. So if you want to know if you have any kind of distress of the SI joint. Check range of motion of the hip. So do your flexion and extension of the hip. Do your abduction and adduction of the hip. And see if there's a difference on the affected side versus the unaffected side. And if there's no difference, there's no indication of distress of the SI joint, of the joint. Therefore, stop acknowledging or accepting that the pain is coming from the joint itself. It's lunacy. It's criminal. Now, go a little further. Is there some other tissue that's in the area that may be possible to be in distress and eliciting pain? Yes, the piriformis muscle. The piriformis muscle attaches to all 5 sacral spine, runs diagonally right over the SI joint on its path through the gluteal region to the hip joint. So for all these geniuses telling you have SI joint dysfunction, which is somehow integrated into the medical system, so I don't really care if you go to an orthopedist, a neurologist, a physical therapist, a chiropractor, they all say the same crap, SI joint dysfunction. It's just part of the mantra, the medical establishment mantra. How do any of them differentiate the SI joint from the piriformis? They don't. They're not capable of doing that because it's not part of their education or training. So I just wanted this first part to help people understand that that diagnosis must be ended. It must be abolished. One other point to make about the SI joint, which would have to make you realize this is an insane diagnosis, is that the SI joint, as described, attaches the iliac portion of the pelvis to the sacral portion of the spine. So it's attaching the spine to the pelvis. The whole premise being that your entire body weight of your torso, your arms, your head gets transmitted to the pelvis, then to the hip and down to the floor through the legs. So the SI joint is a transmittal portion of forces to allow your torso weight to get to the floor. If there was some sort of dysfunction, meaning that somehow the joint had come out of whack, you wouldn't be able to wait there normally. You would literally be hanging off to the side and you would have no ability to create force through that leg and take a step, because the connection of the iliac portion of the pelvis to the spine would have been jeopardized, and therefore you wouldn't be able, as you put your foot down, to press up to support your torso, be able to. There's no transference of force from the pelvis to the spine. So you'd kind of just be dangling with no ability to do so. For everybody who's been diagnosed with SI joint dysfunction, is that what you find? Of course not. I've literally had people tell me they've gone to a chiropractor who said their SI joint was out and they popped it back in. Lunacy, insanity. Where is the presence in reality that says that that's true? There is none. The guy says it or the woman says it, so it must be true. You got to get smarter. The purpose of the Yass method is primarily to educate people, to make you recognize that every single thing that's being said has to be looked at from a logical perspective. Are the words that are being said truthful? Are they logical? Do they make sense? SI joint dysfunction makes no sense. End of story. So for now, take with a grain of salt that you shouldn't accept that. And if this makes sense to you, then seek out the Yass method. You could do so by emailing me at drmitch@mitchellyass.com. It'll be in the description below, or going to the website, livewithoutpains.com, also in the description. And you could make a Zoom session, schedule a Yass method Zoom session so that you can be evaluated and treated for a tissue in that region if in fact it's muscle, which it is in more than 98% of cases, so that the distress of the muscle can be ended quickly and effectively, and you could go on with your life and you don't have to live in pain for another 7 years or another 20 years. In the second part of this two-part series about the SI joint, I will go on and further explain how the Yass method works to evaluate the region and help you understand what tissue is in fact in distress, creating your pain. So we'll follow up with another video in a couple of days, but for now, at least get the understanding that in fact the SI joint is a baseless diagnosis, and in my mind criminal, because it incites people to remain in pain unendingly with no chance. Once you accept that, there's no chance of you moving further on in a path to help you diagnose a tissue in distress in the area so you could address that distress of that tissue, thereby ending its need to elicit the emergency pain signal, the emergency distress signal of pain. If you like this video, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added or when I'm live on YouTube. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.